A marker, a human body, and a caliper were the only tools used for these procedures. Important procedures for this assessment includes all measurements to be made on the right side of the body with the subject standing upright. Caliper should be placed directly on the skin surface 1 centimeter away from the thumb and finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. The pin should be maintained while reading the caliper. You want to wait 1 to 2 seconds, no longer, before reading the caliper. You also want to take duplicate measures at each site and retest if duplicate measurements are not within 1 or 2 millimeters. Rotate through measurement sites or allow time for skin to regain normal texture and thickness. This is the triceps skinfold site, and it's going to be a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon process, with the arm held freely to the side of the body. Next, we have the abdominal skinfold site. It's going to be a vertical fold 2 centimeters to the right side of the umbilicus. Next, we have the chest pectoral skinfold site. It's going to be a diagonal fold 1/2 the distance between the anterior axillary line and the nipple for men, and for women it's going to be 1/3 of the distance between the anterior axillary line and the nipple. Next, we will have the mid-axillary skinfold site. It's going to be a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold, taken at the level of the xiphoid sternal border in the mid-axillary line. This right here is a subscapular skinfold site. It's going to be a diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. Next, we have the suprailiac skinfold site. It's a diagonal fold in line with the natural angle of the iliac crest taken in the anterior axillary line, immediately superior to the iliac crest. Lastly, we have the thigh. It's going to be a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. Firmly grasp a double fold of skin and the subcutaneous fat between the thumb and the index finger of your left hand and lift up and away from the body. Be certain that you have not grasped any muscle in this procedure and that you have taken up all the fat. You can also have the subject first flex the muscle below the site to help distinguish muscle from fat before you measure. When you grasp the skinfold site, your 2 fingers should be about 3 inches apart on a line that is perpendicular to the long axis of the skinfold site. You should be able to form a fold that has roughly parallel sides. Larger skinfolds, such as obese individuals, will require separating your fingers further than 8 centimeters. You want to hold the calipers in your right hand with the scale facing up so it's easier to view. Place the contact surfaces of the calipers 1 centimeter below your fingers. The calipers should be placed on the exact skinfold site, whereas your fingers should be above the site by 1 centimeter. Place the tip of the calipers on the double fold of skin and fat. By marking the skin on the specific sites, you will be able to accurately place the caliper head at the correct location. This will allow for measurement at the same site during duplicate measures. Then you want to release the scissor-like grip of the caliper's claws while continuing to support the weight of the calipers with that hand. Be sure to maintain a firm hold on the skinfold throughout the entire measurement process. Record the reading on the caliper scale 1 to 2 seconds after releasing the scissor grip level to allow the jaws of the calipers to measure the skinfold site. Measure the skinfold to the nearest 0.5 millimeters. Be careful to avoid jaw slippage of the calipers. You want to measure each skinfold site at least twice, and you also want to rotate through the measurement sites to allow time for the skin to regain its normal texture and thickness. If duplicate measurements are not within 1 or 2 millimeters, you want to retest the site. These 2 formulas will help you identify the body density for men and women using the 7 sites. Once you have found out the body density, using the Siri and Brozak equations, you can now identify the fat percentage.